Myself, EmilMathewJohn from IM Tiruchirappalli 1901011. I'm here to discuss about the impact of a pandemic on the Indian economy. The World Health Organization defines a pandemic as a worldwide spread of a new disease. The impact of several trends to be higher in pandemics, in part because of much larger number of people in population who lacks pre-existing immunity to a new virus. When a large portion of the population is infected, even if the proportion of those infected though that goes on to develop severe disease is small, the total number of severe cases can be quite large. The government across the world are fighting the COVID-19 and the maximum efforts are focused on minimizing the spread. Our limited understanding of the virus and the uncertainty regarding when and how the world might be able to cope with its spread is affecting stock markets and investments. No one knows if the restrictions on travel, work will last for weeks or months or maybe for years. As a consequence, the economic impact of the virus will not well understood. The markets will remain volatile. The macroeconomic impact that are obvious at the moment are a demand and supply shock. As the world locks down upon travel, tourism and public events in an effort to socially isolate the highly infectious COVID-19, people will spend less and produce less. It is becoming clear that in many countries across Europe, America and Asia, including India, there will be a sharp, sudden demand shock. This will give a big negative shock to our GDP. While China seems to have been able to shut down many cities and provinces, it required a level of policing and monitoring and curfew-like conditions that our countries, including India, will have difficulty implementing. A pandemic will reduce business investments due to increased uncertainty and risk leading to an excess capacity. Similarly, consumer confidence will decline due to the uncertainty and fear, leading to a reduced spending as people self-quarantine to reduce the probability of infection. This is an example of risk-modifying behavior. Reduced consumer confidence may particularly affect the service sector, which require direct contact. Direct economic effects include increased healthcare expenditures by patients and funders, for example, governments and insurance, and increased workloads for healthcare workers. Indirect effects include small labor supply and due to deaths and increased absenteeism from work. Apart from these, a flurry of economic shocks include a surge in demand for hospitals and other medical services, decline in imports and exports worldwide, closure of schools, college and other institutions, death with regard related permanent reduction in labor force, closure of tourism, hospitality industries with the border being closed, and cancellation of public gatherings, meetings and other events. Greg Dacko, chief US economist of Oxford Economics, says the economy is insured of a recession, at least 2 consecutive quarters of economic decline. Smaller companies will be hit harder than the large ones because of their limited access to credit and less cash in their bank. There will be swath of small businesses that simply won't be able to survive this. Angel Gurria, OECD Secretary General, said the economic shock was already bigger than the financial crisis. It is wishful thinking to believe that countries would bounce back quickly. These unprecedented shocks can have a long-lasting impact on the economy. Therefore, in the light of the pandemic, the UK and Italy has announced fiscal packages, but while most governments around the world are responding with fiscal and monetary measures, even if India does undertake expansionary monetary policy measures, the impact is likely to be limited. Instead, understanding the public health capacity is limited and pushing socio-isolation and prevention is India's best bet. Thank you.